Hello everyone, this is me Dr. Pramee Tamang. First of all, I welcome you all in CEE question answer discussion series. So like a previous year, I'm here to discuss about the mandatory CPD which were asked in 2078. Mandatory CPD includes the questions related to medical ethics, rational use of drugs, infection prevention, ACLS, BLS, and communication skills. The most important thing is mandatory CPD in CEE examination carries 10 marks, which is really important in securing the good position. So without wasting time, let's get started from question number 1. A woman comes to your OPD with chest pain. What will be the physician's first response? Options are, come, let's talk about your chest pain. Take this medication for chest pain. Chest pain are common, you don't need to worry. I will refer you to the best chest physician. Whenever the patient comes to your OPD chamber with some chief complaint, the physician should take the detailed history about the chief complaint. Here, the chief complaint is chest pain. So, the physician should talk about the chest pain, about its onset, about its site, its aggravating and relieving factor, its severity, its associated features, and its intensity. Then only we should decide whether to give medication or to refer to the chest physician or any other consultant. Chest pain are common and they are worrisome. All the chest pain should be taken seriously. Some chest pain may be due to cardiac cause like myocardial infarction, angina, cardiac tamponade, or may be due to pulmonary cause like pleural effusion, pneumonia, ACOPD, or may be due to the esophageal causes like esophagitis and GERD. And it may be simply due to the osteochondritis or musculoskeletal cause. So here the right answer is, come, let's talk about your chest pain. Now question number 2. A mother comes to your OPD for checkup and during talking she starts crying. On further inquiry, she lost her son 2 months ago due to COVID. The best empathetic response would be, the options are, I can feel your pain, I can understand what you are going through, lots of young people have died of COVID, and one must die when you are born. Here, the patient has lost her son 2 months ago due to COVID, and she is under post-traumatic stress state right now. And at this point of time, we should never use such word that pinches her, that aggravates her pain, or that gives her negative energy. We should use such word that at least makes her relief and that gives her positive hope and positive energy. So, C and D options are excluded here. And among the option A and option B, option A is better than option B. So, the right answer here is, I can feel your pain. Now, third questions. Which of the following is true about high quality CPR? Before going to the options, let's talk about the CPR. CPR is the cardiopulmonary resuscitation, which is an emergency procedure that combines 30 chest compression and 2 rescue breaths, that is artificial ventilation, in an effort to manually preserve intact brain function until further measures are taken to restore spontaneous blood circulation and breathing. On the basis of American Heart Association 2015, high quality CPR includes this point: push hard and push fast. Push hard means the depth of the chest compression should be at least 2 inches, that is 5 centimeters, but not greater than 2.4 inches, that is 6 centimeter. And push faster means there should be 100 to 120 times per minute. That is rate of compression. There should be minimal interruption in compression to less than 10 seconds. We should allow full recoil of chest after each compression. Do not lean on chest after each compression. We should avoid excessive ventilation. Too many rescue breaths or too forceful and too pressurized breathing is avoided. Now let's talk about the hand placements during the chest compression. In adult and adolescent, in children from 1 year to puberty, in infants less than 1 year, excluding newborns. In adult and adolescent, 2 interlocked hands with extended elbow on lower half of the sternum. And in children from 1 year to puberty, 2 hands or 1 hand in a small child on lower half of the sternum is used. In picture, we can clearly see that in first picture, two hands are interlocked with each other with extended elbow, and the pressure is given by the base of the hand. And in second picture, one hand is used in chest compression. In infants less than 1 year, excluding newborns, there are 2 methods: 2 finger method or 2 thumb method. It is based on the number of rescuers present during the chest compression. If 1 rescuer is present, then 2 finger in center of chest just below the nipple line. And if 2 rescuers are present, then 2 thumbs encircling hands in the center of chest just below the nipple line. In first picture, if 2 rescuers are present, then we can use 2 thumb, and in second pictures, if only 1 rescuer is present, then the 2 fingers are used in chest compression. So we had options. Depth of the CPR should be 5 to 6 centimeter, 90 to 100 per minute, pressing before full recoil. Compression ventilation ratio should be 15:2. B, C and D are wrong answer. They are excluded because the rate should be 100 to 120 times per minute. We should not press before the full recoil of the chest, and compression ventilation ratio should be 30:2, not 15:2. 15:2 is the right answer if the chest compression is done in infant or children if 2 rescuers are present. Okay, so our right answer is depth of the CPR should be 5 to 6 centimeters. Now, fourth question, which of the following is non-shockable condition? Ventricular fibrillation, pulseless ventricular fibrillation, pulseless electrical activity, and ventricular tachycardia. These are the arrhythmias associated with cardiac arrest: shockable and non-shockable arrhythmias. Shockable arrhythmias include ventricular fibrillation and pulseless ventricular tachycardia, VTVF, right? VTVF is shockable, and non-shockable includes asystole and pulseless electrical activity. So our right answer is pulseless electrical activity, which is non-shockable condition. In which of the Hippocratic oath is controversial? Suicide help by doctor, therapeutic misadventure, euthanasia, or privileged communication? Let's know about the terminologies. Euthanasia is the practice of ending the life of a patient to limit the patient's suffering. Euthanasia is also called happy death or painless. Privileged communication is a legal rule that prohibits the disclosure of private information against someone's will. And therapeutic misadventure is an injury or adverse event caused by medical management rather than by an underlying disease. These are the 4 rules of Hippocratic Oath: beneficence, non-maleficence, justice, and respect for patient's autonomy. Beneficence means the physician should always do good for the patient. Non-maleficence means physician should not harm the patient. He or she should not have any intention to harm the patient. Justice: treat all the patient equally. The physician should treat all the patient equally. There should not be any kind of discrimination on the basis of age, sex, race, or any socioeconomic background. Respect for patient's autonomy. There should be respect to patient's independence to take decisions on their health and on treatment. So here the right answer is euthanasia. Now, 6th question. Patient is diagnosed with COVID. How do you administer remdesivir to prevent hypotension? Slow infusion in IV, orally, intramuscularly, give loading dose and observe. As we all know that remdesivir is antiviral drug which can be given orally and IV infusion. So here C option is excluded because it is not given intramuscularly, and there is no point in giving loading dose and observe. So the right answer would be A or B. Among A and B, we will go for option A because IV infusion is more effective than oral. So slow infusion in IV is the right answer. Now, 7th question. A patient presents with wheezing on ER. On detailed history taking, patient is allergic to peanut and has consumed peanut containing food few minutes ago. Which of the following is immediate treatment in this case? The options are epinephrine, antihistaminic, steroid, and inhaled salbutamol. Here, all 4 options are correct in this case, but we need to pick the immediate treatment in this case. Antihistaminics. Antihistaminics like pheniramine, chlorpheniramine are given. Hydrocortisone 100 to 300 mg is also given. And 100% oxygen is also given. But here the right answer is epinephrine, because epinephrine is the first and immediate treatment given during such cases. Now, question number 8. A patient was done surgery and kept on post-operative ward, then he starts developing fever and other signs of infection. Next, other patients on ward also develop same symptoms. Which of the following can be done to prevent such infection? Options are: start antibiotics to all patients in ward, start antibiotic to that person only, start hand washing before touching each patient in ICU, and disinfect ICU immediately. Here, we should limit the number of the visitors to visit the patient in ICU at first. Then, all the visitors and all healthcare workers should start hand washing before touching each patient in ICU. So here, the right answer is start hand washing before touching each patient in ICU. Regarding antibiotics, almost all the post-operative patient after surgery, antibiotics have already started. So the right answer here is start hand washing before touching each patient in ICU. Now, ninth question. Development of standard treatment protocol is important for rational use of drug, decrease disease burden of community, identifying missing cases, ensure accessibility to treatment. The Curative Service Division, DOHS, Ministry of Health and Population, MOHP, has disseminated a standard treatment protocol, that is STP, for basic health service package. The STP includes guidance on several diseases which aims to efficient utilization of essential drugs to treat majority of the population in standardized manner. So, development of standard treatment protocol is important for rational use of drugs. Moving to the last and 10th question of mandatory CPD, publishing essential drug list in PHC is an indicator of quality of service, service delivery, health status of community, and estimate of annual requirement of drug supply to this center. Let's know something about the essential drug. Essential drugs are those that satisfy the priority healthcare needs of population. They are selected with due regard to disease prevalence and public health relevance, evidence of efficacy and safety, and comparative cost effectiveness. Right? So, publishing essential drug list in PHC is an indicator of service delivery. In total, there are 98 essential drug lists in PHC of Nepal. So, this ends the mandatory CPD which were asked in 2078. I hope it was really beneficial to you all, and all the best to all the CEE aspirants, and thank you so much.